back to County Connections for December. Again, I am Scott Vargo. I'm joined by Dan Gibbs, Thomas Davidson, and Karen Stiegelmeyer, your county commissioners. And we're going to talk now about another issue that has been a subject we've talked about over the course of the last years, and that's healthcare and healthcare costs within Summit County and the state of Colorado. And Dan, you've been very involved in that, and so I guess what's the latest?
The latest is, well, big picture, I mean, we all know that healthcare expenditures are just going through the roof, and nationally it's going through the roof. So over the past 2 decades, we've seen an increase of about 216% per personal expenditures for healthcare. But then Colorado has seen a 327% over that same time frame. So we're all seeing huge increases, but other states are doing things to help curb the overall cost of healthcare. And so Summit County, we've been really involved with trying to shape reform. In Colorado, we were very supportive of a bill that passed last year, HB 1336, that directed the Division of Insurance to do this analysis. And if we did one geographical rating area for the state, what would that mean for your for the expenses, more or less? And so based on that bill passing, there's been kind of a smaller work group made up of Donald Lynn, the lieutenant governor that used to be the head of Kaiser for a multi-state region, Marguerite Salazar, who's the head of Colorado Division of Insurance, Joe Neguse, who is the head of DORA, Department of Regulatory Agencies, as well as representatives from local hospitals. Paul Chakowski's actually on this committee. Doris Kramer Kircher, from Vail Valley Hospital. We have the insurance companies representative as well. But we met over the last few weeks and came up with issues, really. And not that all these issues will be moved forward to be either legislative or administrative changes, but I have a list here of about 15 or so various different options, and they're broken down into local solutions, legislative, and regulatory. And just to give people a quick snapshot of what some of them look like, right now, if you're 400% or below the federal poverty rate, you're eligible for federal subsidies. Well, could the state look at ways to increase it to be 500%? So I know that there's already a bill title that's been submitted, so there's a legislator that's looking at that, but that's going to cost the state money, of course. Hospitals, the agreements between payers and the providers, that's an issue that we're still trying to figure out all the dynamics with that, but insurance companies, as a result of the Affordable Care Act, have certain caps and what they can actually keep for profits. Hospitals don't have that. So some people are saying, hey, let's look at a Maryland model that caps hospital profits to a certain percentage of the Medicare rate. And so those are just, a couple different concepts. I'm pretty confident. Also, the governor's been publicly stating that he would support a certificate of need bill, where hospitals would have to prove, hey, there's a real need for expansion or a particular service in a region. And you see that more of a bigger issue on the Front Range, where you see Centura, you see CU Health, and Health One, the three biggies really just kind of buying up each other, and we used to have a bill in Colorado, a law that said they had to approve the certificate of need for additional services. So I think we'll likely see a bill regarding that. So
yeah, you see a lot if you go down to the Front Range in particular, but you see it on a smaller scale here in Summit County. But you see emergency room centers and urgent care centers sort of popping up on every other corner. It's like the old gas stations where you had a gas station on every corner. Now you have an urgent care or an emergency room on either side of an intersection with competing hospitals. And so certainly those things cost a lot of money to build and to operate. And so there's a certain increase in the expenses of all of those agencies that then need to raise their fees in order to recoup that cost. There's only so many people that need to go to the ER and to the urgent care. So
Definitely. So, we're still we're going to be very much engaged in whatever legislative proposals come forward, and just like last year, we're going to try to encourage the public to come down to testify, to be a part of the process, because that's pretty unique in Colorado, where you don't need an invitation to show up to state capitol and state your opinion on different proposed bills. So, really hope that we have a really good, strong showing for Summit County.
Good. Good. Well, I will again say Dan has been a huge leader in this arena for Summit County and for the state of Colorado, and so we're fortunate to have Dan working on this and spending as much time as he has trying to address this. It's a giant need, obviously, within our community. It was 2 or 3 years ago that we were identified as the most expensive premium when the Affordable Care Act first came out. That dropped a bit after an effort by the three of you, and then bounced back up again, and we continue to see those double-digit increases every year, and it becomes more and more challenging for folks to get health care here.
Yeah, I mean, it's interesting thinking of just the increases. I mean, people are going to expect between a 20 to 26% increase come 2017. But we're seeing some areas of the state seeing 46% increase. I'm trying to think what some of the higher ends. The folks that are part of the small and large group plans are definitely more insulated, I would say. And we're seeing average increases of about 4%. But in Summit County, it's actually at 20 to like 25 on the high ends. But some parts of the Eastern Plains and some parts on the West Slope are 46%, I believe, was the highest for a bronze plan increase. So.
And I guess the good news, so that's all bad news, of course, but the good news out of that is that there are now other parts of the state that are impacted, as well as the sort of rural resort region, and so it gets some more attention at the state level when more people are feeling the pain. So
But boy, oh boy, if ever there was a David versus Goliath, Dan is David.
definitely the case.
The leadership that he's demonstrated for all of Western Colorado is amazing with regards to what needs to change in this state with the system. So I'm very, very proud of you and what you've done.
Thanks,
Good
man.
stuff.
Go Dan.
Thank you.
Go Dan.
All right, our last subject of the day. So there's snow in the photo behind us.
Oh, look at that.
And there's actually snow now on the ground in Summit County. So
It's snowing right now.
and it's snowing as we speak. It has been
It's dumping.
a slow start to the winter season, but we want to talk a little bit about winter is here and what we need to do to prepare.
Everybody speed up. Drive faster. Right? Oh no, wait a minute. That's okay.
I was going to tell my story of driving back from Denver yesterday. People on I-70 were actually driving about 25 miles an hour.
Oh, wow.
That's what the conditions were like. And if you didn't have proper traction, you were in trouble.
Yeah.
So you need to have good snow tires. It's worth it. It's really a little investment compared to the cost of, getting stopped and getting fined because you cause an accident with your bad traction, or you get into an accident. And so invest in those good snow tires.
And put your emergency safety kit in your car in the event that you do end up, for some reason, being stuck, not because you didn't have snow tires, but because the road's closed for whatever reason, and you're stuck out there for several hours. You want to make sure that you've got proper things in your car as well.
Yeah.
I think more about this now that I have kids that are driving, and so have to be aware of all that stuff. Any other comments for you guys before we shut her down?
Have
It's
a great
good
holiday.
for the kids, especially, to spend money on gasoline so they don't run out
Yes.
when they're driving,
Yes.
because they didn't want to spend the money on the gasoline.
Or for the parents to spend money on the gaseline, which is more the case.
Yeah, but the county's going to get extremely busy over the next few weeks. So be safe, everyone on the roads, and have a good time.
Yeah, enjoy the snow. All right, great. Thanks very much for tuning in. Lots of other good stuff on SCTV 10 and 22. Enjoy.